minutes, and I'm going to kick off the being in the chair, and I'll kick off the first round of questions for 6 minutes. And my first question is to Ms. Weber. On October 2nd, you testified at this committee that no funding from Health Canada was being used to purchase crack pipes. Do you still stand by this answer today?
Chair, is that good? You can hear me? Great. I really appreciate the opportunity to clarify the funding that goes from Health Canada to harm reduction projects. So while Health Canada does not directly purchase harm reduction supplies, Health Canada does provide funding to community organizations that do invest in prevention, harm reduction, and treatment projects. And that funding can be used for harm reduction supplies to minimize the transmission.
Ms. Weber, it was a pretty direct question. I said, does Health Canada, is any of the funding from Health Canada being used to purchase crack pipes? It was just a yes or no answer.
I appreciate the question. Yes, we do provide funding to community organizations for harm reduction tools, including pipes, yes.
So Health Canada stated that it does not track individual expenditures and is unable to provide a breakdown of how recipients spent funding under the Substance Use and Addictions Program and Emergency Treatment Fund. If you do not track individual expenditures, how do you know that no federal funds were used to purchase crack pipes?
So I did say that funds do go to community organizations, and I did say that they are used by those organizations to purchase harm reduction products, such as pipes.
Like crack pipes?
That's right.
So,
and we provided examples of that in our written response. And we do not track individual expenses down to the minute level, but in fact, we do track categories of expenditures, and those do include harm reduction equipment.
Okay.
And we did report that back in the written question in detail.
According to Health Canada, funding under the Substance Use and Addictions Program and the Emergency Treatment Fund can be used to purchase smoking kits. Is that correct?
That is correct. Similar to the pipes, harm reduction tools can be used, purchased from the funding for harm reduction.
And what substances do you think addicts smoke out of smoking kits? Health Canada is funding.
A variety of different substances.
Like what kind? Fentanyl?
I wouldn't want to assume. I would not want to assume that.
You wouldn't want to assume? You're in charge of funding these sites. You must know one type of drug. Fentanyl? Would that be in your experience?
In one of the programs that we did provide in the written question, it was for meth. And so we did answer that. There was a program.
According to your own department, actually 48% of the usage is fentanyl.
It can be fentanyl.
Yeah.
But I don't want to speak.
Over half the times.
Because we know that fentanyl is one of the most harmful substances on the street, and illicit fentanyl. And that is correct. So providing those harm reduction tools is fundamental.
Are you aware that many drugs are smoked with foil, including heroin, fentanyl, crack cocaine, crystal meth, and some crushed pills? Yes or no?
Yes. I do imagine that they are used.
Has Health Canada funding being used to buy foil kits for drug use? Yes or no?
In the listing that I have seen, I do not recall foil, but we do provide money for harm reduction tools. So I do suspect some have purchased foil. I don't have that in front of me, but I could go back to the written question that we provided where we listed out the harm reduction tools that organizations did use spending for to prohibit.
During my recent visit in Kelowna, I saw a vending machine on a public sidewalk that dispensed drug supplies such as crack pipes and foil, and no ID screening was required. Like, it was quite remarkable. I could just walk up, hit a number, just like a regular vending machine. Is Health Canada aware that these vending machines are operating in Canada? Yes or no?
Those machines are providing clean
harm
reduction tools.
Is Health Canada aware that these are operating?
Point of order, Mr. Chair. Mr. Chair, I think when you are sitting on a chair, you have to be very...
What's your point?
My point is that I think when you're sitting on a chair, anyone...
What is your point? What do you...
Point is that you have to be neutral.
Thank you. I'll duly noted.
Yeah, thank you.
Thank you very much. It's
thank
my
you.
time.
Please be respectful.
From the listing that we provided in the written response that we funded vending machines, but I do know that community organizations are supplying through vending machines to enable access at all hours. so that there's the reduction of the transmission of infectious disease or harm.
Weber, do you honestly think Canadian taxpayers want their money to be used for crack pipes and meth pipes and fentanyl pipes?
The funding is for harm reduction in response to this toxic drug crisis that we are facing.
Do you think taxpayers would be pretty happy about that?
The money is going to organizations that are in the community
To buy
that are
crack
taking
pipes.
responses.
Order,
to
Chair.
support
Please let the
vulnerable
witness answer so she can
individuals
have
who are using
time to
toxic
answer.
supplies.
It's okay. Ms. Weber, has any funding from Health Canada's Substance Use Addictions Program been used to purchase controlled substances for drug use? Yes or no?
Period of time, the Substance Use and Addictions Program funded prescribed alternative projects. In very, very few cases, I think in fact 3, where the actual projects did not have drug coverage from the province, prescription or prescribed alternatives were funded for a short period. In general, the pharmaceuticals are funded by the drug programs in the provinces and territories.
Ms. Weber, Health Canada's own website describes supervised consumption sites as places where people can bring their own drugs to use in the presence of trained staff. Does Health Canada require that a licensed doctor or nurse be physically present whenever drugs are being consumed at these sites? Yes or no?
A licensed doctor or a practitioner? No, there are health practitioners that are on site at different times and different shifts. The requirements vary by operation. But to give you a 100% answer on the practitioner, did you say a nurse practitioner? Yeah. I would have to get back to you to confirm that or not.
Thank you very much.
Thank you.
If you could table all that, that'd be great. Okay.
Thank you, Chair. This first question is for the Deputy Minister or Assistant Deputy Minister of Controlled Substance. Any money from the Department of Health spent on encouraging recovery?
Health Canada does fund projects and programs across prevention, harm reduction, and treatment and recovery.
Treatment and recovery. Okay. It seems when you talk about harm reduction and crack pipes, how does a crack pipe do anything for harm reduction? I'm not following. Is it a transmission thing?
That's right, infectious disease. And so you
Infectious
can
disease.
imagine that whether there's a sharing of pipes or needles between individuals or multiple use and dirt or whatever the case may be, the clean tool reduces the harms for the individual.
Okay.
And then when they are looking for helps or supports, they're able to, turn to
Because
the
there's something that just doesn't add up. You say that you're decreasing harms, so why are needle injection injuries up? Because we are handing out needles, we're handing out crack pipes, but yet our hospitals have a sharp increase in needle injection injuries, and these are serious. Any thoughts on that?
I'm not aware of the data on the needle injury. Is that nationally that you have that stat?
No, I'm speaking specifically about provincial in Alberta. What I find is that Health Canada enables and the provinces are promoting recovery. So in Alberta, we have been looking really at how these safe injection sites really don't promote any type of recovery. You say that they are harm reduction, but in Red Deer, where my riding is, it has decimated our downtown. We've lost hundreds of businesses. There's one business that loses $8,500 a day due to shoplifting from this safe injection site. So I would like to know how that is really harm reducing, because all we're seeing is more injection injuries. And as for the crack pipes, I can't wrap my head around how that makes a difference. I can tell you that some of the examples. So, how many reports regarding threats to public health or public safety has Health Canada received about illegal hard drug consumption sites?
I think we tabled a response in a written question. We were asked about the complaints that we received for the supervised consumption sites, so we did provide that in a written answer.
Okay.
So I I wouldn't go through it right now. It would be time consuming, but we did
Well, you
table
got
that.
201 reported complaints, right?
That's right. Some of them are general, some of them are related to loitering, some of them are a number of complaints, and I think we listed them in the
Okay, so it's safe
response.
to say, to assume, I guess, far more complaints have been received regarding these sites.
More than, I think that, I don't know what the comparison is. In fact.
It's your data.
Well, I didn't say more than, like, we've listed the actual complaints in that listing. So the question asked us if we received complaints, and then we listed them by supervised consumption site in the written response.
So drug dealing, aggression, property damage, public nuisance, breaking in, littering, among others. But according to Health Canada, these complaints, I'm going to quote it, do not relate to infringement of public health or public safety, but are general statements of views regarding the presence of the site, end of quote. Would you not consider, Ms. Weber, any of the previously mentioned complaints like drug dealing, property damage, break-ins, or aggression a threat to public safety?
So the response that we've provided outlines where there were issues, like you listed, and then there were some that were general concerns, and I think that may be a footnote
Yeah.
that you had read. So just to be clear, they are concerning complaints, and that footnote, I think, applies to the general inquiries.
Well, it's exactly what we're seeing in Red Deer. So if you think it's okay for Canadians to be put through this threat and decimate our downtowns, but I'll be back with some more questions. Thank you, Chair.
Thank you, Chair. My question is for Ms. Weber. You've talked a lot, well, we've talked a lot today about providing crack pipes and other drug-using material. So if an individual comes to use these illegal hard drugs over and over again, are they simply allowed to continue to do so, or does Health Canada encourage these individuals to stop using drugs?
So our strategy for supporting individuals during the crisis is a full continuum. It's prevention, so it's encouraging and ensuring that people do not start using the drugs. It's harm reduction when people are using the drugs, and it's also treatment and recovery, and then of course also enforcement.
Okay,
so the full
so, Ms.
continuum
Weber-
of activities are key.
Oh, thank you. I just wanted to know that in my riding, huge riding, and in Oakard, there is no treatment available. What would you suggest should happen to the people that are being continually given drugs but have no treatment available?
So thank you for the question. An important role that the provinces and territories play in the country is healthcare system delivery. And the transfers that do go to the provinces and territories are also used for substance use and treatment.
So we shouldn't be maybe continuing, because I know you said you're monitoring the drug supply, you're monitoring these drugs, but you aren't checking to see whether the full continuum is actually happening.
So we work with provinces and territories, and we work with municipalities and non-governmental organizations. The provinces and territories play the primary role and the lead role in healthcare system delivery.
Okay.
We've talked about today already Alberta's recovery model, which is an example of the recovery and
Okay,
treatment
but
that's
not
taking place.
in where we live,
In
so,
BC, there's
yeah.
a road to recovery. Sorry, BC, is that correct?
Yes.
Yes. So in British Columbia, the province has put in place a road to recovery that includes the full continuum of care.
Unfortunately, that's not happening, and you can see it by the number of deaths that have happened in the last few years, and of course, because of decriminalization. So that leads to my next question: How much have you had to increase the substance use and addictions program funding towards British Columbia since your department provided a waiver to allow the decriminalization pilot program since 2023?
So our substance use and addiction program does fund projects across the country.
So how much do you know for British Columbia? If not, you can you can table
I'll
that
table that
later.
after the fact. Yeah,
Great,
thank
thank
you
you.
for the question.
I was wondering for my next question. You told the committee last time that you were regarding a renewal of the exemption in BC, so a renewal of the pilot program. When the request comes in, will assess public health and public safety indicators. Has a request been received to extend the decriminalization pilot program in BC? Yes or no?
No,
Okay.
a request has not been received.
Okay. Mrs. Kendall, if you do receive an extension request, will you reject it considering the thousands of people who have died since this program started? Yes or no? In
We've not
BC.
received a request. I would be be going outside to assume what any decisions would be made. We haven't received anything.
So
to
you would
date.
have to assess if you received a request.
Any
of how
application
many
that
people
we
had died.
get comes in, we do assess
Okay.
it thoroughly.
So my next question is, Ms. Kendall, in an abstinence-based program, in my community of Penticton, we have Discovery House, which is an incredible organization that has saved so many men and reunited them with their family. It's abstinence-based. It's been extremely successful, embraced by our community. Would they score higher for the substance use and addictions program application process as opposed to an organization that runs an injection site?
There are a variety of projects that we fund, and it can be the need, it can be actually what they put forward, but it's not based on the type of programming that's delivered. But
Oh,
that
so
does
you
sound like-
are funding abstinence-based programs like Discovery House?
Today, I don't want to say something that would be incorrect, so I'll get back to you to let you know,
Yes.
but I don't have the actual, we fund hundreds of programs.
Okay, so you can't remember one abstinence-based one, though?
If I said it right now and I didn't get it right, I would really regretfully not
Could you
wanna do
table
that
with
to the
this committee the number of abstinence-based programs, organizations that have received funding through the substance use and addictions program?
You can take that question back. Thank you for the
Thank you.
question.
Thank you.